Government at all levels have been called upon to make concerted efforts aimed at ameliorating the sufferings of vulnerable children and make health care as well as other social services accessible to them. Parents and pupils of Atundaolu School for the Physically Challenged made this appeal in Lagos during a one-day outreach program initiated by Tamar Homes Foundation.
Available statistics indicate that over 30 million Nigerians live with one form of disability or another. Out of this number, 33% account for children between the ages of 0 to 15. Findings also reveal that the community of these people are often deprived of social inclusion, stigmatized and discriminated against, a situation that prompted the government to set up the National Disability Commission to address the myriad of these challenges. 2 years down the line, not much impact has been felt. Advocacy groups and the community of PWDs insist that equality and inclusion is non-negotiable. 15-year-old Nifemi Mobolade lives with his parents, who depend on help from organizations like Tamar Homes Foundation for her medical and other social needs. She wants government's urgent intervention.
Government should please do more about medicine, about nurses.
We need a doctor, nurse to help us, and we will be happy if you will be able to do that for us.
We are so happy seeing this foundation putting smiles in the faces of the children with special needs. They are here to support what Lagos State have been doing. They donate wheelchairs for the children that are physically challenged and cerebral palsy for the children in the school. So on behalf of the parents, the pupils, and the staff of Atundaolu School, we are saying a big thank you.
Some parents of the children with the special needs appeal to the government, non-governmental organizations, and well-meaning individuals to prioritize the plight of this group of citizens, especially the children at the grassroots.
Many people, they don't even take their children to the clinic. If we ask them, they will tell us that it's because of the hospital bill that they bill us. When we get there, sometimes like me, I buy like 30,000 drugs, sometimes 20. But I've stopped going to the clinic. It's not because of the money, but just because I didn't see changes in my daughter because she's an autism. So I just thought and looking upon God.
And the medicine have not been here, really. And the one that is available are costly, unaffordable for us to purchase. Okay? And we are begging government to use this opportunity that please, they should look into it. We are not saying they should take care of it laterally, but if it's cheaper for us and affordable for us, we parents.
Olajumoke Rema is the founder and chief executive officer of Tamar Homes Foundation, who says this program is one amongst many of her outreaches that seeks to provide relief to both the parents of the children and the community of people living with disabilities.
The last one we did in December, when I visited their school in February, I really thought maybe they wouldn't even recognize me. You know, like they were all over me. They were so happy, and I love the fact that they are eager to learn. Some of them are learning beads, vocational studies, and all. So I just want to support them, for them to know that they are not forgotten, they are special, and that we are here for them to encourage them as well.
Olajumoke acknowledged government's effort in providing for these special needs children, but advocates for more from government, NGO, and well-spirited individuals.
I've gone around several of these hospices, and I want to say thank you for what you're doing in Yaba, in Surulere, in several other places. Well done, and you would be amazed that drugs as little as 1,500 that these children need to keep them at peace. These children don't need to stay indoor 24/7 sleeping. They can come to school. So I believe that if government, subsidizes the drugs that they give to children like this, I think it will go a long way to calm them down and also to be of great help to them as well.
Besides the medical outreach, The foundation also donated 22 wheelchairs, 15 cerebral palsy chairs, food items, amongst other relief materials.
Ladies and gentlemen,